Okay, okay. Let's see what we're working with here. Didn't we just have you in for a face adjustment a little while ago? Yeah. It's quite the shiner you got going on right there. What was that? You had a cranial nerve exam with Deadpool. Huh. I did not think that he was a doctor and he punched you. Oh, no wonder you got that. Well, why don't we give you a little cranial nerve exam today? Because it looks like those senses are pretty out of whack and will need to be retuned. I've already been checking out a little bit on your face here, and it's definitely a little off, but we can get you all recalibrated today. Alright, so let's just start with your face here, just a little inspection. Just gonna palpate those temples a little bit. Does it feel the same or different when I touch them? A little different? Okay. Alright. So I'm just gonna come up to your temple here, and we're just gonna press a few of the buttons. Okay. And we're going to do a little more. Okay. Let me just adjust this knob on the side, and there we go. Let's go to the other temple, same thing, just gonna press a couple buttons. Okay. Let's put in this one. Okay, let's just turn that knob. Good. Okay, that should fix that. I feel the same or different now. Okay, good. I'm just gonna check under your eyes, feel those sinuses. Just palpating. Okay, seem to be alright. Can you go ahead and give me a smile? Just make sure those facial muscles are working. Frown. Yeah, I know. Dr. Deadpool should not have whacked you. Raise your eyebrows for me. Nope. Try that again. Nope. Going to have to just work on that a little bit up there. An eyebrow is just not functioning properly. Try now. Okay. Let me just. Try now. Better. Good. Okay. Just check out those cheeks real quick. When I touch you, can you feel that? Okay, so definitely some sensitivity loss in the skin. We can adjust that. Check out your chin, your jaw here. Just feel around. This feels okay. Itch in the eye, right? Not the jaw. This feels alright. Alright, I'm gonna start with your eyes today. Okay? Alright. Okay, so I'd like you to just look straight at me, please. And follow the light with both eyes. Just follow the light with both eyes. Good. I'm just observing you. But seeing a little bit of drifting in both eyes there. Okay. I want you to just look straight ahead. I'm going to cover one eye, and we're just going to swing the lid in and out, just looking at your pupil response, and oh yeah, zero contraction. Well, we can fix that for you. Good. Oh yeah, that's gonna need a fix. It's alright though, we can take care of it. Take a look inside your eyes with my ophthalmoscope here. So you see, a little light. I'm gonna get really close, okay? Basically forehead to forehead, so just hold still. I'm just gonna take a look at your eye. Look up for me. No, you say you're looking up. Your eye's going down to the left, and it's going right, and to the right, and now we're going left, and up, and we're still down, and now we're up. Okay. Well, we'll fix that. Alright, this eye. Up for me. Nope, that's down. Down for me. And we're up and left. But we're right, and we're left. Okay. Seems like we have a little bit of work to do on those eyes. I'd like to do one more quick test, real quick, easy, okay? What color's that? And what color's that? Alright. Color recognition is way out of tune. Not calibrated whatsoever. So, we are going to start with checking out the calibration buttons under your eye. And then we are going to do a little fine tuning to make sure that you have your colors all worked out, okay? Alright, so I just need you to stay still for me, and we're just going to work on the eye a little bit. Ready? Button, button, button. Good. Button, button, button. Okay, and just gonna tune the tiny knob here, little bits at a time. Okay. Let's adjust your focus on this eye real quick, okay? So we're just going to turn it out of focus. Okay, and then we're gonna move it back into focus. Good, good. Alright, let me just put a few more adjustments in. I think I'm gonna put in the perma code so that this calibration setting can't be changed. Okay. Let's look on the other eye now. We're just gonna do the same thing. Button, button, button. Okay. Alright. And let's tune the knob out of focus. Good. And into focus. Good. Alright. Let me take a look inside those eyes again. Just to make sure we're on the right track. Just look straight. Alright, look up. Good. And down. Good. Left. Good. And right. Wonderful. That seems to be back in working order. Let's check out the other one, just to make sure. Alright, so, good. Look up for me. Good, and down. Good, left. Good, and right. Good. Okay, good. Let's work on that color vision. So what I'm going to do is I'm going to turn the knob on the side of your eye, and you should see different colors coming through, okay? And you just need to identify which color you see, okay? Alright, here we go. Ready? And blue, good, and green, good, yellow, very good, red, wonderful, purple, great, and black and white, okay, and back to normal. That is fantastic, my friend. But I would like to run a few eye tests on you just to make sure everything's working properly, okay? We're going to start off very easy with our eye chart here. So I want you just to read the letter I point to, okay? Good. 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 Read this line for me. Wonderful. Let's just do a few more. Just look straight at me. And just follow my finger. Good. Good. And let me know when you can no longer see them. And when you can see my fingers. Ready? Good. 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 Great. Okay, my friend. I'd like to do one more eye test with you. So, what I'm going to have you do is look at a spot back on the wall, wherever you want. I'm just going to observe your eyes, make sure that I'm not seeing any of that lagginess, dragginess that I was seeing earlier. Good. Alright. Don't get distracted by my finger. Just follow the light. Don't get distracted. Good. Just follow that light. Focus on the light. Focus on the light. Good. Wonderful. Well, let's say we got those eyes retuned. I'm going to move on to your sense of smell and taste real quick. If you don't mind, would you give me a big ah? Just take a look inside your mouth real quick. Okay, so didn't knock any teeth loose, so that's good. This might need a minor adjustment. And go ahead and give me a smile again. Yeah, we can clear up the sides of those lips there, fix that smile a little bit. I know we adjusted it last time, but it looks like it could use a touch-up after that whack. Okay. Just lean your head up for me. I'm going to take a look up your nose. Okay. Yep. And, yep. Okay. So, definitely need an adjustment on the nose. So, look straight at me. You can close your eyes if you wish during this part. I'm just going to get your nose here and we're just going to good and now good. Go ahead and smell for me. Breathe better. Good. Okay. I just want to test your sense of smell now real quick. Got a little liquid here that has a very fragrant scent. I'm just going to spritz it in the air. You let me know what you can smell, okay? Vanilla. Very good. Alright. Let's just click a few buttons on the side of your nose real quick. Just want to lock these adjustments into place. That way, if you run any more of those little anti-heroes, they can't mess you up. Let's get that smile recorrected. So I'm just gonna sketch out the corners again. Good. Okay, the other side here, just same thing. Okay, good. let's just test everything. I'm just gonna feel your nose again. Just feel, make sure that feels right. Good, and I'm gonna just check your smile. Perfect. That's what I like to see. Okay, so now I think we gotta work on those ears, and then we're gonna get all those sensory nerves reconnected in your skin for you, okay? Alright, so if you'd like, you can just close your eyes. I'm gonna take a look inside your ears, make sure that nothing was knocked too loose, okay? Come on. Handy dandy otoscope. So that's it. You can close your eyes. I'm just gonna come take a look inside your ear over here. Boy, you completely reset your ear calibration over here. Alright, other side. Okay. We can get those all fixed up. So, I am going to now work on your ears, alright? And then we'll do some hearing tests. If you'd like, you can just keep your eyes closed for this portion of the exam. I'm just going to scoot on over here real quick, and we're going to just start pressing those inner ear buttons. And you just relax for me, and we'll take care of this for you. Just gonna turn that little knob in there. Good. I need my other tool so we can go in and recalibrate a few of these things. Yeah, let me just turn this other knob here. Good. And we're gonna button. Good. Button. And turn. Okay, and let's let that ear rest for a minute. Let's see if we can get those calibrations to take. We're gonna come over to the other side now. We're just gonna go inside the ear. Button. Turn the knob. Good. Button. And turn. Button. Turn. Okay. Let's give that ear a rest now. Go back to the other side. Same thing. Button. Turn. Okay. Okay. We're going to mute your ear for a second, okay? Alright, just relax. It's fine. Keep your eyes closed for me. Alright, in 3, 2, 1, mute. Unmute. Good. That's fixed. Let's go back in. Button. Turn. And let's put this slider back to where it was supposed to be and slide. Good. And let's adjust this one over here and slide. Good. Button. Okay. Button. You're doing great, don't worry. Button. And turn. Okay. Let's give that a rest. Hey, you're doing great. We're gonna get you all fixed up, okay? And on this side again. Button. Turn. Good. And let's adjust this slider. 3, 2, 1, slide. Okay. We're gonna mute this here to do a reset, okay? Just relax. 1, 2, 3, mute. again, and button, 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 turn, and slide. And we're gonna adjust the slider back over here. Slide. Okay. Just gonna go back in the other ear now, because I saw some earwax in here I want to clean out, and I think it's hiding some of the other little buttons, so just relax, close those eyes, and we're just gonna come in here and we're just gonna pick out that wax, okay? Good. A little bit more. Yeah. Okay. We almost got it, don't worry. Almost there. Ah. It was hiding a few buttons. Let me just get those little ones, okay? Button, and knob. And let's just adjust this tiny little slider down here and slide. Good. Alright, and we're going to go back to the other ear, get that little bit of wax out of there, okay? Alright, and pick. Okay, pick. Okay. How you feeling? You doing okay? You're doing great, I promise. Just a few more little picks to get out the rest of that wax. Good. Alright. Pick. Okay. We're gonna go get those buttons in there now. Alrighty. Just relax and button, and knob. Good. And we're just gonna slide that little slider there, and we're gonna adjust the other one down a little bit. Good. Alright. Just gonna get the outside ear buttons now. We're gonna go do this side. Button. There's a few right here on your ear I want to get. Button. Okay, good. Let me just adjust the outer knob here. Just gonna fine tune your audio a little bit. Good. Sounds better, right? Yeah. We're gonna do some hearing tests on you though, just to make sure everything's good. Let's get the outside buttons over here. Button. Good. And turn that knob a little bit. Button. And one more little knob adjustment here. Okay. That should be feeling much better. Okay, I'm just gonna examine your ears real quick, and then we're gonna do some hearing tests, alright? Okay, so just relax. Just gonna come over here, examine the outside of your ear. Make sure that we are fully recalibrated over on this side. Nope. Let me just button. This slider on the outside. Let's adjust that a little bit. Yep, okay. Just good. Much better. Alright, let's get this side. Let me just get your ear. Good. Yep. Let's get this button. And this slider. Good. And one more button here. Okay. Awesome. Alright, so we got those ears, I think, recalibrated. I'm just going to take my otoscope again and look inside. So you just relax, and I'm going to look inside. Good. Oh yes, that's much better. Look at the other side, and oh yeah, that's all back to where it should be. Great. So we're going to do some hearing tests now. And one of those tests is going to be a little ear puff called a pneumatic otoscopy. So I take this little bulb here, stick the otoscope in your ear, and just blow a little little puff of air just lets me know that your tympanic membrane's working, okay? Okay. So just relax. I'm just going to put the otoscope inside, take a look, and on the count of 3, we're going to puff, okay? 1, 2, 3. Good. 1, 2, 3. Good. And 1, 2, 3. Wonderful. See, not so bad. Other side. Again, just going to look inside your ear again, and 1, 2, 3. Good. And 1, 2, 3. And 1, 2, 3. Fantastic. Just going to take another look inside. Good. And this side. Good. Okay. Okay, my friend. So, looks like those ears are back in working order. I want to run some hearing tests on you, just to make sure everything is good, okay? Alright, so I have you close those eyes. I'm going to whisper a word in each ear, and you just repeat it back, okay? Alright, here we go. Keep those eyes closed for me, and dream. Good. Vacation. Good. Coca-Cola. Good. Cookie. Good. Totodile. Good. Magnezone. Good. Sleep. Bliss. Okay. Very good. Keep those eyes closed for me. I'm going to make a sound in your ear. You just lift a finger or tell me which ear you hear it in, okay? Alright, here we go. Ready? Good. 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 Awesome. And good. Good. Yep. Yep. Yes. Good. Good. And now let me know when you can no longer hear the sound, okay? Good. 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 Yep. Great. Alright. You can go ahead, open your eyes for me. And those ears are in perfect working order now. So we're going to move on to the final portion of today's exam, and that's going to be recalibrating all of those senses in your skin. So we're going to start with a sensation test, and you're going to let me know if you can feel the different things, and that'll give me a baseline for what we have to adjust, and I can already tell it's going to need some adjusting. So we're going to start very simple. We're going to touch you with the soft object or the dull object, and you're going to let me know which is which. So close those eyes, and soft, good, and nope, that was dull. That was dull again. That was soft, but that was probably an easy guess, so let's try something different. Alright, so I'm going to either touch you with the plastic or the wood, and you're going to tell me which is which, okay? So is it wood or is it plastic? Ready? It's plastic. Nope, that's wood. No, that was wood. No, that's plastic. Okay, let's try another one. This time we're going to use a dull object that is metal and the wood again, okay? So keep those eyes closed Okay. This might be a tricky one. Alright, this time we're going to do soft or dull. Soft or dull. Okay? Keep those eyes closed, closed, closed. Can you feel the difference between this and this? No? How about this and that? No? Okay, how about that, and this? No. Okay. Okay. So we're going to have to do quite a few adjustments on that face. So if you'd like, you can close your eyes. I'm just going to be recalibrating the buttons on your face and drawing some new sensation, lines, and connections, okay? So you can just keep those eyes closed for me. And I'm just going to press the buttons. Okay, let's just draw this line down the nose. Good, and down the side, and the other side. And let's get under the eye. Under the eye. Okay. And then the tip of the nose. Okay, and under the nose. Good. Let's check on the cheek here. Let's draw in a outline. Okay, and then we'll put a few new connector lines there. Let's put a new sensory point there, and there. And then one more here, and there. Let's connect these ones. Okay. Let's do the other cheek, same thing. Let's get an outline going. Okay, good. And let's put new sensory spots there, here, and there, and connect them. Okay, and let's fill that in a little bit so we don't have a blank spot. Same thing on the other cheek, let's fill that in. Don't want to have a blank spot. Just gonna check your chin real quick, let's see. Yep. Just get those buttons under the lip there. Just draw the connectors. Alright, button. Lift up your neck for me. Just a little bit. I want to get, yep, there's that tiny button right there on the jaw. And on that side, and right under the chin. Okay, good. Let's check that forehead. Yep, button, and let's move that slider. Good. Alright, and let's move this slider here. Alright, and let's do the one on the cheek. Good, and other one on the cheek. Good. You're doing fantastic. Keep those eyes closed for me. Just got a few more buttons I gotta press on you, okay? Button. And let's tune up next to the eye. We'll get rid of any of those minor wrinkles. Just gonna erase those for you. Wonderful. Let's get the other one. Just erase those little tiny wrinkles for you. No, we can keep the smile lines. I'm just getting rid of the bad ones. Don't worry. Good, and button. I'm just gonna crank the knobs on the side of your temples real quick, so just hold still. It's gonna be okay. And here we go, ready? tune. Good. And then one more back. Perfect. 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 Alright, let's just do the forehead one more time. I think there's a few more buttons I want to get. Button. 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 Alright. And button. 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 Let's do your whole face slider real quick. And good. And the side slider. Good. And from the other side. Good. Let me just make one more connection. Make sure all the new sensory input points on your face are connected, okay? Just going to draw down to all the points. And finally, let's just put in the lock code so that these calibration settings are permanent and you won't get them reset at all. And they should increase your tingles. Good, okay. Let's do another sensory test. So, first we're going to start with distinguishing different materials. So, close those eyes, and you tell me if it's metal or if it's wood. Metal or wood. Okay? Alright, ready? Metal, good, and wood. Metal. Wood. Wood. Metal, good. Okay. And now I want you to tell me if it's the soft object or the dull object. Okay? Alright, here we go. And soft. Dull. Dull, very good. Soft. Soft. Dull. Dull. Soft. Soft, good. I want you to tell me if it's the softer or the soft now, okay? Okay, keep those eyes closed, closed, closed for me, and softer, good, and soft, soft, softer, softer, soft, soft, softer, good. Okay, one more test, and this is going to be if you can tell the difference between 1 point or 2 points, okay? Alright, keep those eyes closed, 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 and 1 point. 2, good. 2, 1, 1, 2, 2, 1, 2. Wonderful. Go ahead and open your eyes for me. Well, my friend, I have to say that it looks like we have you all recalibrated and tuned up. How are you feeling? Great. Alright, so what I'm going to do now is I'm going to put a sleep code in for you, okay? So this should kick in relatively soon. You can choose to stay here at the Tingle Clinic tonight. If you'd like, we offer complimentary hotel services for our patients who need a little extra rest, or you can go home. This won't kick in for a little bit, so you'll be able to make your decision. But in the meantime, I would like you to go to the front desk and subscribe to our services so that we can make sure that you are always staying up to date, okay? Alright, so put that sleep code in now, and you can